Hi there and welcome to MRI Safety Considerations and Practical Applications. My name is Leah and today we will be talking about magnetic resonance imaging and its various safety concerns. As an MRI technologist of almost 10 years and a certified MR safety officer, I have considerable experience with both theoretical and practical scenarios having to do with MRI safety. I have screened and trained new students, new technologists, nurses, respiratory therapists, and many more on the importance of magnet safety. This will be a practical and informative guide for those stepping into the MRI department, whether for the first time or the 10th. We will cover basic magnetic resonance physics, safety protocols, exam contraindications, adverse events, risk versus benefit scanning, ask a few questions, and conclude. The magnet is always on is a commonly stressed phrase, and for good reason. Most diagnostic imaging magnets are superconducting, which means we use superconductive wire, approximately 200 kilometers worth, in the magnet housing, along with extremely cold liquid helium to keep that wire from having resistance. This allows us to maintain the magnetic field all the time. The strong magnetic field forces our body's hydrogen protons to align with it. Then we rapidly pulse a radio frequency current to excite those protons. They release energy, or signal, which is captured by our coils. The amount of time it takes for those protons to realign with the magnetic field, as well as the amount of energy released, changes depending on the tissue type. All of this is measured to give us the beautiful contrasted images you see on your screen. Let's move on to basic MRI safety screening protocols for personnel and patients, as well as implant information and conditions. Arguably the most important part of this presentation, we need to stay vigilant in screening our patients and staff thoroughly. Ferrous metals such as iron, like this bobby pin, will immediately pull towards the magnetic field. The closer you get, the stronger the pull. Items as small as this bobby pin can become dangerous projectiles in the MR environment. There are 4 zones as delineated by the ACR, the American College of Radiology. They are as follows. Zone 1. All areas that are freely accessible to the general public without supervision. Magnetic fringe fields in this area are less than 5 Gauss. Zone 2, still a public area, but acts as the interface between an unregulated Zone 1 and the strictly controlled Zones 3 and 4. MR safety screening typically occurs here under supervision. Zone 3, an area near the magnet room where the fringe, gradient, or RF magnetic fields are sufficiently strong to present a physical hazard to unscreened patients and personnel. Zone 4 is synonymous with the MR magnet room itself. It has the highest field strength and poses the greatest risk. All ferromagnetic objects must be removed and excluded before reaching this point. It is important to have a handheld magnet of at least 1000 Gauss nearby just in case you need to test an item, like your MR conditional oxygen tank. There is also a quench button that should be used in cases of emergency, such as if someone has become pinned to the magnet by a ferromagnetic piece of equipment. Pushing this button will ramp down the magnetic field by releasing the helium through a quench pipe in the ceiling. Please note that this is a last resort in an emergent situation and requires a very expensive fix. Now, there are certain contraindications to having an MRI exam, and we take careful steps to ensure proper labeling of implants. There are 3 specific MRI labels that we follow: MRI safe, MRI conditional, and MRI unsafe. These helpful categories allow us to more efficiently streamline our screening processes. From a cataract lens replacement, MR safe, to cardiac stents, MR conditional, to breast tissue expanders, widely MRI unsafe. MRI safe means there are no risks posed by putting the item in any MRI environment. MRI conditional means that the item can be scanned safely provided that certain conditions are strictly adhered to, such as field strength and scanning parameters. MRI unsafe implants or items must never enter into the MRI room. If a patient has an implant, it is our responsibility to research that implant for conditions under which we can scan the patient safely. Now we will delve into common adverse events and an unfortunate accident that has been well documented. As you can see from this graph, the amount of adverse events is actually trending upward, despite our best efforts to curb them. This could be because these events are being reported more often, or it could be because we are simply scanning far more patients than we were 20 years ago. Although there are differing opinions here, one thing is clear. The most common adverse event we see are burns. Burns in the MR environment can occur from multiple origins. Tattoos in the RF field, skin-to-skin contact such as tip of thumb touching the thigh, and loops of wire connected to skin with EKG leads and pulse oximetry. They're all common examples of burns that occur in the magnet. This is because an electric current is induced through a small area of high resistance and heat is generated. That heat translates to burns in some cases and should be avoided at all costs. We do this by placing heat sinks like ice packs on tattoos that are in the RF field, and non-conducting pads like those seen here, so patient's skin is not creating a conducting loop. MR unsafe EKG leads and pulse oximetry should be removed or replaced with an MR conditional equivalent prior to introduction to Zone 3. Another common adverse event is projectiles. Just like I spoke about earlier with this bobby pin, people can and have been severely injured or even killed in the MR environment due to MR unsafe items making it into Zone 4. One such example is the Michael Colombini case, in which a young boy was crushed to death by an MRI unsafe oxygen tank that became a projectile as it was brought into the scan room by an uneducated staff member. The event occurred in the summer of 2001 in a New York hospital. Unfortunately, the oxygen tank was introduced to the room by a nurse or anesthesiologist while the two MRI technologists were in the computer room. No MRI safety practices or training had been established at this hospital. The boy was struck in the head and died as a result. This horrific and tragic event kickstarted the ACR into publishing the MR Safe Practice Guidance document, the first of its kind, in 2002. It's important to remember that something as small as a hairpin can become a dangerous projectile in the MR room. We must stay vigilant in our mission to keep patients safe. To that end, we will discuss risk versus benefit in the MR suite. The most commonly accepted method was created by Dr. Emmanuel Canal and is called the 3 buckets method. This method utilizes a strong benefit versus risk analysis to determine exam eligibility for patients with MRI conditional or untested implants. It is important to keep in mind that the radiologist will have the final say on whether or not a patient can be scanned safely. But it is our duty to provide as much clarifying information as possible to aid them in their decision. The 3 categories, or buckets, are the static magnetic field, gradient magnetic field, and the RF magnetic field. Taking into account the body part being scanned, as well as the implant type and location, we can deduce the amount of risk to a patient with a certain implant. If the exam is for a foot and the patient's implant is in their back, what is the actual risk? Some of these are easier to answer than others, but they all require a certain amount of critical thinking. Many implant manufacturers, such as Medtronic, have already done the research and will offer the conditions freely. Others are untested and therefore require a radiologist sign-off to continue. Now we will ask a few questions and conclude. Question number 1. What is SAR? SAR, which stands for Specific Absorption Rate, is an extremely important term in MRI because it helps us understand the amount of energy deposited by a radiofrequency field in a certain unit of mass. It is measured in watts per kilogram, and the level of SAR is often the main determining factor in scanning MR conditional implants. Question number 2. Who is responsible for a site's MR safety policy? Well, the short answer is the lead radiologist or medical director at your site. But I would encourage you to look into the American Board of Magnetic Resonance Safety, which certifies MR safety officers, usually technologists, safety experts, usually physicists, and radiologists or medical directors on how to efficiently and safely create long-lasting, effective policies and procedures for your MR department. So what did we learn today? Well, we discussed how the physics of MRI allows us to obtain incredibly detailed and diagnostic images of the body. We discussed the need to have safety policies and procedures in place to ensure public and personnel safety in the MRI suite. We went over the contraindications to having an MRI. We learned about adverse events that can take place in the MR environment, and we discussed the utilization of specific risk versus benefit analyses to scan patients safely. In conclusion, MRI is an excellent imaging modality and diagnostic tool, but it requires attentive and rigorous screening protocols to ensure patient and employee safety. Thanks for your time.